Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now, today's topic, we're going to talk about knee pain. So how to use acupressure point for knee pain, right? What about the knee pain? The knee pain is over here, all right? So the knee pain either will be in here on the side or on the front or on the back, on the side of here, or on the back, It doesn't really matter where the pain is, because the area, the acupressure point that I'm going to show you is going to be for all the pain over here, all right? Now, if you're an acupuncturist, you know there are different meridians, 6 different meridians. So we have to get to the point to get relief for knee pain, right? So for this method, it doesn't really matter. It doesn't matter whether you have suffered from arthritis knee or an injury, or you have no injury, just a degeneration knee problem, or a tendons problem, ligament problem. It doesn't really matter, right? As long as that is the knee pain, as long as there's probably a stiffness in the knee or weakness in the knee, or even a tightness in the knee, right? Doesn't matter what the causes of the knee pain, right? And this point gonna help you, right? So it's simple. Let me show you the technique first. So thank you, Juanita. Thank you for leaving a comment here. I'm happy to join your video. Thank you very much. Thank you for your support. And if you are in here on Facebook, Instagram, and a Facebook page, please give me a thumbs up, and please share this video to your Facebook page as well, because more people join me, and it'll be even better, because this video gonna help more and more people. Today's actually the day 14 of our New Zealand lockdown time. Yeah, so in this 14 days, I just every day I do a live video to show you acupressure point for pain on the body, right? So I want you to support me, and I want you to ask you to please share this video to your friends, to your Facebook page, and to the social media page, either Twitter, Instagram, doesn't matter. Just share with that, and please give me a thumbs up as well, and then as well as tag the person that you wanted to see this video. You can tag it directly on this video, right? So let's start. Where is the point of the acupressure point? Where should we do it, right? It's actually on the elbow. We're going to do it on the elbow. Okay, I'm going to show you where exactly the point is. I'm going to show you the technique first. So what technique do we use, right? First, so every video, every live, I'm going to show you this technique, because the technique is so simple, right? The reason I show you again and again, because you don't have to go back to see the other video to learn this technique, right? So use your index fingers. So over here, so make a fist, index fingers up, and bend your index fingers, and use your thumb to support the index fingers like this, right? So you're gonna use the knuckle over here to press on the point. This is the knuckle, right? So alternative, you can use your thumb. So give me a thumbs up like this. Just follow me, do it right now. So bend your thumb and put your tip of the thumb over here on the index fingers here. That's it. So use over here as a massage device to press the point. And you can also use the thumb as well. So you can use thumb over here, and you can use the other joint, knuckle, and it's up to you. And even though you can use this, you see, of this using the massage device. Can be that part or that part, right? Then when you hold this massage device, don't hold it like this, because if you hold it like this, you're gonna have pain in the joint. You know, it's gonna be very tired. Hold like this, right? Or hold like this, right? Use all fingers, hold it. You know? And let's show you where's the point. The point is easy. Let me show you over here. So my elbow over here. This is my right side of my elbow, but you may see it on the video as left side, okay? Because what happened, the camera we use is actually opposite. Okay. Now, if you bend your hand a little bit, bend your elbow a little bit, you can feel that the tendon. If you straight it like this, you can still feel it, but it's much difficult to feel the tendons. So bend it a little bit. So over here, so on the outside, when I say outside is on the tendon, there are two sides, right? One is on the thumb side, one is the little finger side. So first on your thumb side, right? On the thumb side. On the thumb side, so use your knuckle and to press on it, right? To press on it. Massage it like this, okay? Massage it like this. So if you hit the point, the sensitive point, go for 30 seconds. Go for 30 seconds, right? So on this point, you're gonna do it on. You're gonna do 2 or 3 fingers below this. You know, you're gonna do here as well. Go down to hit the point. If you can get the tender spot, keep working on it, and keep going on here as well. If you get the sensitive point, just work on it for 30 seconds. Then you do upper as well. Try the upper one. I don't feel anything in here. I just feel a little bit in here. So that point I should get 30 seconds. That's it. So why I do upper and lower is because some knee pain, it won't be just on one spot. It can be, especially the stiffness or the pain, it can be an area. Right? It can be lower or upper, right? So it may be in here and as well as lower and upper. That's why I introduce here, just not do it on one point, just go lower and upper as well to find the most sensitive point, all right? Get the most sensitive one first, and then you feel a lot looser on your knee, you know, either side of knee. Then the next point you're gonna do is, that is the tendon, right? Go to the side of the tendon, the next to the tendon and the point on the little finger side. So over here, right? So over here, then what you're gonna do, you're gonna do again 3 finger below here and 3 finger above there, right? And keep going. Go lower a little bit, so to find the point over here. So this is tender. This is quite tender for me. And keep going on that one as well, and that's tender too. And I should do 30 seconds in here, 30 seconds in here, and lower in here. 3 point, 30 seconds in here as well, right? So when you finish all here, you can go above. No point, nothing for me, and nothing for me. 3 point above, nothing for me. Forget about it. All right. And the last one, right? 3 different meridian. If you're an acupuncturist, and here you get the point, you just insert needle. Okay, get the needle in, right? If you know how the meridian balance each other, pen about on the back side, you needle here. Pen on the side, you needle here, right? But hey, this video is, if you're an acupuncturist, you know how they balance each other, the meridian. Then you can directly put needle, and you can save the time. You know which meridian treat, balance which meridian. But if you're non-acupuncture, it doesn't matter. Doesn't really matter. You just go 1, 2, 3. Go and detect to find out the sensitive point all along all the meridian. When you hit the meridian, just go forward and release all the meridian. So which means you work more point, but it'll still work for you, right? Trust me, it will still work for you. And the last meridian is we call heart meridian, right? So bend your elbow in the crease of in the end of the crease over here. Oh, sorry, you didn't see it properly. In the crease of this, the crease, you have to bend it completely. So in the end of the crease over here, this is the point. If you have any question, you're not sure about anything, please leave a comment there and I'll give you the answer. I'll answer you. So over here, 30 seconds, right? Then you put it straight a bit and you go down to the fingers. See whether there's any pain. No, nothing at all. Nothing for me. It may be for you, but if it's 10 liters for you, you should do it for 30 seconds. And go above 1 point, nothing. 2 point, nothing. 3 point, all right? So remember, I'm going to show you again those 3 point. Tendon on the thumb side, on the little finger side. Then that's 2 point, right? Bend your elbow in the end of the crease, 3 point, right? Those 3 point, which is 3 meridian, it can balance all 6 different meridian over here. But the pain may not be just on the right on the meridian, you see? What if the pain between the meridian, which a lot of time between meridian? So I want you to go 2 more points. And those 2 more points is in here. Let me show you. So the 2 more points is, that is the tendon, right? Right on the tendon, which means the side, there's a point on the thumb side of the tendon and the other side on the thumb side of the tendon, and between is on the tendon. So on the tendon, you don't normally feel pain, okay, but go below, lower, and that is tender. Normally it's painful, okay, just a little for me, and yeah, that's one is quite tender for me, yeah, and go as well, and above on the tendon, above the tendon, not normally people have this one, but go a bit, the second point and the third point, and normally very, very tender because they're right on the tendon, right? So then and that's another point at between that one. So that is the point that next to the tendon, right? On the little finger side, right? And that's another point. So I put 1 point in here, my fingers mark it, my finger index finger mark in here, and I use my ring finger mark on the other point. The other point is when you bend completely, then you have in the end of the crease, all right, in the end of the crease, then you see that there's a gap in between those 2 points, my index fingers and my ring finger, right? So between that, my middle finger over there, so that's another point, and that point for me, oh, that is the most tenderness spot for me, right? In between actually. So, and then you can go 3 point down below. It's a tendon here for me, and here, and here. Not much for me, so I should do 30 seconds over here, and 30 seconds over here, and above here, and above here. So nothing on above there, it's just a little bit in there. 30 seconds, all right? That's it. So those are the points for knee pain. Those are the points for knee pain. Again, if an acupuncturist, you hit the point, the most tender spot, give a needle, right? So you may feel needle there. If you're not sure which meridian, just go and detect all the point and give needles over there. If you know which meridian, balance which meridian, then you directly go to that meridian and get to the point and insert needle. If you're not an acupuncturist, just go step by step. We watch the video again, go step by step and detect all the point in this area, which is 3 going down, 3 above there, go those area, then it should give you immediate relief, right? Then you may find, if you keep following my video, you find, oh, this point actually working. I'm showing you this work for knee, but actually I'm showing you this previously work for eyes, right? Yeah, same thing. It will work for your eyes as well. That's the beauty of Chinese medicine and acupuncture. The point here, it can treat your knees. It can also treat your eyes. Okay, so same point. I didn't show you other point. I show you actually the same point that work in here for your knee pain, but it actually can be for your eyes as well, eyes condition as well, right? That's how beautiful that is with Chinese medicine. Hi, Cameron, how are you? Now, if you're up here, please give me a thumbs up and share this video on your Facebook and let more people know about what we're doing here. Thank you for thumbs up and love. And we're showing to let your friends and family know that we're doing live video every day to help they do some acupuncture point at home to relieve pain, right? And leave the comment there. If you love this video, leave a comment there or leave a message there and ask your question if you want. If you want me to do any video for you, just put it down there and I'll do it earlier for you. The search for today, and remember, you're gonna do it every day, and your aim is to do it once a day. Even if you don't have knee pain, just do it once a day, every day. And if the knee pain happen and you do an extra one, then if the pain keep getting better and better, just keep doing it. Your aims get rid of the tenderness spot over here. It may take weeks or even months. Okay, and if you get rid of all the tenderness spot in here and you still have pain, that is the time you should come to us for acupuncture, because acupressure is so different with acupuncture. Acupuncture work better and Chinese herbs work better for your organs imbalance as well. If there is a structure change, it's very bad structure change, it may not work for you, then hey, that is something that you should find acupuncturist to help you. Okay, the structure change or organs very, very weak and you do this, it may not work for you, right? And for the others, it should work instant. It should give you instant relief. Once you get instant relief, keep working it. If it getting better and better and it stop there, it can't get any further, can't get any better, and you still have the stiffness and a bit of pain, but you can do a lot of things, then that is something that you should come and see us, and we can find out what is the underlying issues for you, and we can suggest you other acupressure point to work on, or we may give you acupuncture and Chinese herb to work together to get rid of your knee pain. So that is the purpose for it. All right, that's it for tonight. Happy lockdown time for day 14 today. All right, we're gonna see you tomorrow, which is day 15 of our Injit lockdown time. Stay awesome, and I love you all, and I'll see you tomorrow. See you. Bye bye. Hi everyone, welcome.